Hello, my name is Bev G, and I'm a student at UMD taking Writing 1120 with Kevin Swanberg. Today I'm going to be talking about um, mental health telehealth visits. Minnesota only has enough psychiatrists to fulfill 34% of its population's psychiatric needs. In Duluth, there is one psychiatrist to In Minneapolis, there is one psychiatrist to 45 patients. In Duluth, there is one psychiatrist to every 112 patients. This map represents the shortage of healthcare professionals. The purple represents shortages of health professionals in rural areas. The green represents shortages of health professionals in low-income areas. The gray is undesignated. One way to solve the problem of shortages of healthcare professionals is telehealth visits. And to provide healthcare professionals less stress. Telehealth visits reduce cancellations and no-shows and prevent traveling in the winter when it is dangerous to do so. Although telehealth visits may not be covered by insurance, and hackers might be able to hack into medical data, and it may delay treatment, although healthcare professionals can stay online with their patient until an ambulance arrives. There are several positives to telehealth visits. For example, one woman in Iron Range was on a telehealth call with her psychiatrist, and every time she would be on a telehealth call with her psychiatrist, she would cover her computer so that she wouldn't have to see her own face. This was one symptom that helped her psychiatrist diagnose her with her diagnosis. There are several other things that patients do that psychiatrists can see over telehealth. For example, their speech, what they're talking about, and their body language, how fast they're talking, their tone, and several other things that have to do with their speech and the way that they talk, that their psychiatrist can observe and help diagnose them. Telehealth visits are a great positive thing in today's world because of the coronavirus and people not being able to go into hospitals and seeing their patients. So this is a great way to be able to go in and get your help that you need. Telehealth visits should be more available, and yes, some psychiatrists might need to be hired in order to fulfill all the need, seeing as though Duluth only has one patient to every 112 providers. But perhaps there could be doctors from other parts of the state that could cover the other parts of the state. For example, having doctors from Minneapolis cover other counties and things like that. What I need you to do today is write a letter to Governor Walz asking him to pass some laws so that Telehealth visits can be accessible to all, and insurance covers these visits. Thank you for your time, and have a great rest of your day.